I'm Dr. Denny Thomas, longtime physician in Prineville, Oregon. I'm Dr. Denny Thomas, longtime family physician here in Prineville. I practiced here since 1954, retiring in 1994. I graduated from medical school in 1952, had the usual one-year internship, and then I had a year of family practice residency before arriving here in 54. My practice was pretty general. A good part of the practice to start with was obstetrics, which was always a good practice builder. We delivered the babies and then followed them through, perhaps until they graduated from high school. Once in a while, you might even receive a graduation card from them. I delivered many hundred babies here and enjoyed that part of my practice very much. The changes in medicine have been vast and great since I began my practice. Get myself together here. One must understand that there are some things in medicine which do not change. The basic sciences, anatomy and physiology, biochemistry do not change, and those disciplines do not have to be relearned. But the rest of medicine is in a vast state of change, has been for 50 years, and I'm sure will be for another 50 years. The differences between now and then are remarkable. At the time I first started, there were very few drugs which actually worked, probably no more than 15 or 20 drugs that we felt we could rely on. But that therapeutics has increased vastly since that time. Now I presume there are thousands of drugs that are in daily use. And I'm sorry, I had something else in mind, but it is now possible to tailor individual drugs to illnesses, and hard for me to. Antibiotic therapy was just in its infancy when I started. Penicillin was on the scene thanks to an English physician named Dr. Fleming. I believe it came on the scene in 1929, and it was widely used during World War II. Sulfa, of course, had been here for 75 years, I suppose. But the mycin drugs came along in the 50s, and from then on there was just a steady proliferation of new and better drugs. Now we must have thousands out there. But we have not yet reached utopia, because there are still some illnesses which defy treatment. We've all heard of the recent Ebola virus. There is no satisfactory treatment for that. The mortality rate is 30 or 40%. They are struggling with a vaccine for Ebola. And AIDS, while it can now be controlled with antiretroviral drugs, it cannot be cured. And we do have some tough bugs out there that are defying solution. We have a drug called MRSA, which has been plaguing St. Charles Hospital in Bend in the past, and that MRSA stands for methicillin-resistant Staph aureus, and they've arrived at the point where no antibiotic will handle that drug. But there may be a solution eventually. As far as diagnostic aids go, there are thousands now which the field of radiology has just exploded, and we now have scans, MRIs, CT scans, and those images produced by the scans are remarkable in their clarity. It's almost looking like a textbook. So that's been a remarkable change. When I first came, the little town of Mitchell over in Wheeler County had no physician. They hadn't had for many years, I think. But at that time, there were 3 sawmills going. Hudspeth Sawmill was running 2 shifts at that time, and there were 2 or 3 other mills in the neighborhood, and there were a lot of people in Mitchell. And and my partners saw that as an opportunity, so we set up a little office over in Mitchell. And from 1954 to 1958, I went over 1 day a week and serviced the Mitchell community. Our offices were in the old hotel there in Mitchell. The waiting room of the hotel was, or the lobby of the hotel was our waiting room. I took a nurse with me, and we saw 25 to 30 people every day. In a sense, it was like turning the clock back 50 years or so. I had a stethoscope and a microscope, my 5 senses, and that's what I used for practicing medicine. If patients needed lab or x-ray care, I sent them on over to Prineville. But that was a very successful and enjoyable time for me to practice. The community, I think, loved us very much. We had luncheon invitations out 3 or 4 weeks ahead, and made many good friends over there. There were always house calls when we finished up. Somebody out in the boonies would want me to come out, and which I did, of course, and that was all part of it. But after 4 years, the mills started closing one by one, and I eventually closed my practice. But many of those Mitchell folks stayed with me, and I continued to see them in Prineville for years and years. I still have many good friends in the Wheeler County, and I loved it very much. I guess I could mention okay, and I subscribed to 2 or 3 journals that I could read and try to pick out topics which would be interesting, and had a lot of people actually call me at home about something I might have said, but finally KRC was sold and no longer had a station here locally, and that's when I gave it up. But that was a very enjoyable interlude for me. Let me think about something else. When I came in 1954, the Pioneer Memorial Hospital was relatively new, having been built in 1950. The community was all very proud of the hospital because it had been done without any federal fund intervention. The hospital cost $300,000, which was a large sum in 1950. But it served us very well for many years. I always had a few patients in the hospital with varied sort of illnesses. I delivered 4 or 5 babies a month for many years there. In those days, we kept the mothers for about 3 days, sometimes 4 days. Now I understand they're being discharged even on the day of their delivery. I was always very fond of our little hospital here. I thought we did a very good job. Our statistics were good. We had very few infections or any serious problems. We had a variety of supervisors, some good, some not so good. But overall, my feeling about the hospital was very positive, and I realized that hospitals do age and even perhaps become obsolescent, and it is time for Pioneer Memorial to be replaced, as is being done now by St. Charles. I'm hoping that we will have as good an experience with our new hospital as we did with in the past. Pioneer Memorial Hospital did have an emergency room, and it was staffed by the local staff. Each of us took a week on the ER call, and we saw everything that came through on an emergency basis. If we could handle it, we did so. If it was too tough, we referred the patients on over to St. Charles and Bend. But eventually, the ER was staffed by full-time physicians who did nothing else, but originally the medical staff here took care of the ER. We had a very good emergency ambulance service, and over the years the attendants became more and more skilled. The physicians, the local physicians all had a part in instructing the attendants as best we could, but in time they got to the point where they knew more than the docs, I think. But talk to me again about what else, Ramona. We did a lot of surgery in our hospital, and our chief surgeon, my very dear friend and mentor, was Dr. Elon Wood, and I assisted him with his surgeries for probably 25 years. He did a great job for the things that he attempted, and I think our patients got along very, very well. There was hardly any post-op infections. Everything usually went quite smoothly. Dr. Wood did any kind of abdominal surgery. Of course, at that time, before the laparoscope, the abdomen had to be opened completely, but we took care of gallbladders and peptic ulcers and bowel obstructions, and of course appendectomies, and did a lot of hernia repairs too. But my impression overall is that that part of the practice went very, very well. The hospital ran into some tough financial problems in the early 80s, and at that time there was a concern about possibly putting the hospital on the tax rolls, but instead the hospital foundation was designed, and we had a huge auction every year to raise funds, and I think with those funds we were able to keep the hospital fairly contemporary, upgrading the surgery, the ER, the obstetric wing and so on. And so that hospital foundation played a big part in keeping us going for many years.
How many were on the board?
The board? I think the hospital board was maybe 8 or 9 people. Yeah. We had a big annual meeting where all the interested people, which was most of the community, would attend and talk about problems, procedures, and so on. That was a big thing every year. Surgical practice now is entirely different, primarily because of the laparoscopic surgery, which came along probably in the 70s or 80s, I think. But surgery now has made tremendous advances because of the invention of the heart-lung machine. Almost any procedure on the heart is now possible, up to and including total heart replacement. Right. Yeah. Our treatment of heart attack in the past used to be watching the patient very carefully with repeated electrocardiograms. That was before the intervention of stents and things like that. Now, I think most of the, in my latter years of practice at Pioneer Memorial, we were sending those people pretty routinely over to Bend, where they were investigated with dye studies and often a placement of stents in the heart vessels. I'm sure now the outcome for people with heart attacks is far, far better than it was when we were treating them. We were state of the art as far as did what we could, what was available, but we didn't have the advanced stuff that's present there now. The biggest changes probably were in the field of therapeutics, which I have mentioned. The vast increase in the number of effective drugs versus the 2 or 3 dozen that we had when I started. That has been a huge advance, and the huge proliferation of diagnostic studies, the various scans and ultrasounds and so on that assist in diagnosing nowadays.
So
I can remember one incident where there was a 2 or 3 car crash out on the Madras Highway somewhere, and there were, I think, 5 or 6 injured people who were all brought to the hospital, and our entire staff, all 4 or 5 of us, came up, and each of us took care of one of the patients, and some went to surgery. We assisted there, but of that bunch that were injured, I think they all survived, perhaps with a few scars, but I think that was a great effort for the entire staff pulled together and helped out these people. There were a lot of very serious injuries that came through, very often from the logging woods or from bad chainsaw lacerations. Early on, we handled most of those things here ourselves. A little later in my practice, I think we tended to refer because Ben got more and more specialists, and it was probably better for the patients that we got to move there to Ben. But early on, we did almost all of, there were very few referrals, and we took care of everything here as best we could. There were no jealousies, I don't believe, between the medical staff, and if one of us needed assistance from another, he came and willingly gave his assistance and help. There was never a problem of, there were no prima donnas here at that time. Not while I was practicing. A number of physicians would come and go for a while, and a few stayed on, of course, but we had no women while I was in practice here. I don't think there was any prejudice against them necessarily, but nobody applied for admission to our staff that I know of. I came in the summer of 1954, and during that same summer, Dr. Eben Jones also came and set up his practice. And Dr. Jones was a very good physician, practiced solo for many years, and did a very good job. He was well regarded and well respected in the community. Can't think, huh? Yes, we all had hospital privileges, and all admitted our patients there. And we did have a staff meeting once a month, and actually we reviewed any of the tough cases or any of the deaths that had occurred. The attending physician would get up and tell the rest of the staff exactly what he had done and why the patient died. And so we kept pretty close track of the quality of care here, I think. The hospital board was around for many, many years, and I think they had a monthly meeting. I was a member of the board for a short time, and they would discuss the finances and perhaps any problems with physicians. And I think since St. Charles has come on the scene, I'm not sure that the board is needed anymore. I have a question of whether Rhineville will have any sort of say in the operation of St. Charles. I think we should have some representation. on their board or somehow, so that we could express ourselves if things were not going quite as well as we thought they should. We all did postgraduate courses, and we read the same journals that our compatriots in the Mayo Clinic read, so we tried to keep up to date with modern medicine, and I think we did pretty well for a small community hospital. One of the physicians was appointed each year as the chief of the staff, and he was the head of the half a dozen or so that we. But I can remember a time or two saying, "Well, isn't it about your turn to be chief of staff?" "No, I did it last year." But that's. Every death was investigated and critiqued and commented on.
Anything else?